You're listening to the Yoga Medicine Podcast. I'm your host, Rachel Land. This podcast brings you information and resources to enhance the therapeutic effects of your practice based on a deeper understanding of anatomy, physiology, and the integration of modern science and research with traditional practices and experiences. Join me and my co-hosts Tiffany Cruikshank and Katya Bach as we dive into all things yoga, research, and wellness.
The content of this podcast is not medical advice and is not meant to replace medical care. Please consult your healthcare provider to determine what is best for your unique healthcare needs.
Well, hello and welcome to the Yoga Medicine Podcast. Thank you so much for taking time to talk to us today.
I am so excited and honored to be here.
I'm looking forward to getting nitty-gritty on the topic of concussion because I think it's one of those things that is very different for different people. And so it can be so easily misunderstood or unrecognized. And if we can, I'd like to just get straight into it. But you have such an interesting background in between dance and yoga and triathlon and neuroscience and performance coaching. What got you interested in concussions to start with?
Great question. I did my bachelor's in neuroscience, and as I was moving through that, I started thinking about how I really love sport. And there were questions around how the mind's involved in athletics. And that led me to do my master's in kinesiology, sports psychology. But towards the end of my master's, as I was thinking about next steps, I started really missing the micro level, like the neurons, the synapses, the neural basis of behavior and athletic performance. At the same time, this was in 2009 that I was finishing my master's, the concussion story was really starting to get out there. And it was being described as an epidemic. And concerns around sport concussion, particularly, were becoming a lot more mainstream. So I figured, this is cool. This has to do with sports. This has to do with the brain, of course. So why don't I go explore this? It'll allow me to get back into neuroscience, but stay in the sport world. And I went in with a very specific question. I went into my PhD program wanting to understand and contribute maybe one brick to the wall that really examined what are the long-term effects of repeat concussions when they occur in adolescence. And that was my question. I got to dive into it pretty much at the beginning. And yes, that launched the whole concussion exploration for me.
I'm almost scared to ask you about your outcomes because you're describing my partner who played football when he was a teenager and had, we can't even count how many concussions. So I'm not going to ask you what the outcomes are. I don't think I want to know.
Okay, but there is some good news. So just know that.
Okay, good. I'll hold on to that knowledge that there's good news in there somewhere.
Absolutely.
You've done an online course for yoga medicine, yoga and concussion, which I've done and I found fascinating. And right at the outset, I realized that I had actually no idea what caused a concussion, what it actually is. It's one of those terms that I'd heard and I nodded because I know what it is. But when we really got down to the mechanics, I realized I had no idea. So perhaps you could start by talking about what a concussion actually is, what causes it in the brain.
Yes, a concussion is a type of mild traumatic brain injury. Sometimes people are familiar with traumatic brain injury or the acronym TBI. Well, you can classify a TBI based on severity. And a concussion is defined as a mild TBI, even though it doesn't feel mild to the person experiencing it. It's caused by a bump, a jolt, or a blow that results in temporary alteration of normal brain function. So let's break that down a little bit. We usually think about concussions as the first part of the definition. So the bolt, the bump, the jolt. That's the initial biomechanical insult But there's a secondary injury, and that refers to all of the changes that happen on the cellular level. And that lasts a lot longer. So the hit itself, whether to the body and the force transfers to the brain or to the head directly, is pretty temporary, right? It happens pretty quickly, but there's a whole sequence of events that happens in the brain after that initial insult. Concussions can be caused by motor vehicle accidents, falls, assaults, or sports injuries. And they are diagnosed by a neurologist or a medical professional who has some training in concussion management.
Mm.
And unfortunately, that's not as widespread as it needs to be. But it's starting to happen. My husband just started coaching our 6-year-old's soccer team, and he had to go through just some really basic but very important concussion training. So that's for the coaches. There are more neurologists that are being better versed in concussion management, as well as school nurses, athletic trainers, for example. So we can talk a little bit about how it's diagnosed.
Yeah,
And
I was surprised that it wasn't something that was really easy. Oh, we'll just do a scan. Yeah, there it is. It's nowhere near that straightforward, which I found fascinating.
I'm so glad you mentioned the scans because I
Mm,
think that's often the go-to. It's there's a suspected concussion. Let's take this person to the urgent care, to the emergency room, and get a CT scan. That's typically what may be ordered or requested. The problem is, CT scan will not show a concussion unless it's a pretty severe concussion and there's some fracture or brain bleed. You're not going to see a concussion on a CT scan. So, how is it diagnosed?
mm,
Well, the best way is to do a combination of a neurological eval, which includes some vision testing, hearing testing, balance testing, looking at coordination, reflexes, strength, and also cognitive testing, which is how is their short term memory? Do they have delayed recall? How is their concentration? And there are different tools to assess that. And
mm.
it's important that the person using these tools has experience with them.
Yeah.
So there are a lot of tools out there from the SCAT-5, which is to be used only by medical professionals. But then there's the concussion rating scale, where you can, or the post-concussion symptom scale. So you can look at a variety of symptoms and rate the severity of them to get a total score. Anyone can do that to get some sense.
Hmm.
There's also now, at least in the US, it's happening. I don't know about New Zealand or elsewhere, but there's baseline testing that's starting to happen more with youth athletes. So a
Yeah.
lot of young athletes are required to undergo typically something called impact testing because someone's baseline is going to be different from their teammates' baseline. So how do we
As you were
really
describing the
know?
diagnosis, I was thinking, I've got bad vision, but I've got good hearing, and my balance is okay in some instances, but not others. And I've got a good short-term memory, but not great cognition. Yeah, so kind of figuring out the person that you're testing post-injury, is that the same as the person beforehand? You don't know unless you've done a baseline. So that makes perfect sense to me. Mm,
Exactly. Yes. So that's how it's diagnosed. It is a lot more complicated
yeah,
than
I'm sure.
most people, think at first, but there's more education happening, and I'm really hopeful for the direction this is going, so that
Mm.
concussions don't go undiagnosed because that's when you can get um, into some trouble, and the person who sustained it unfortunately will have to or may take longer to heal or won't know what to do. So
Yeah.
that's really the key.
Yeah, and in the course, you described it as an invisible illness. And I thought that was such a powerful description because not only is it usually invisible from the outside to look at the person, it's also to some extent invisible to brain scans, depending on what they have access to. And even to the person who's experiencing it, because it's altering your perception, your experience, it can be invisible to them too. How do you chalk up whether this is down to me hitting my head last week, or whether I'm just tired today, or having a bad day, or didn't have my coffee this morning? So, because of that invisibility, let's talk about what some of the symptoms can be. And I know there's a really wide range because, disrupting networks in people's brains can have all kinds of flow on effects. So maybe you group them into some categories for us to help us get a picture of what it might look like.
Yes, that's the best way to do it. So we typically divide symptoms into three broad categories. Somatic, which is the physical, what's
Mhm.
happening in the body. Those can include things like headache, dizziness, nausea, vomiting, fatigue, loss of coordination or balance. That's different from your normal lack of
Mhm.
balance. Vision issues, hearing issues, or sensitivities. Neck pain is very common. Whiplash commonly occurs with concussion, especially for motor vehicle accidents,
Mhm.
and sleep abnormalities. So those are some somatic physical changes that you want to see are different from your baseline state. So yes, you may have hit your head getting into your car, and then a couple nights later you have a bad night's sleep. That's not necessarily indicative of a concussion. But if all of a sudden your sleep patterns are changing and you are feeling typically much more fatigued during the day, or experiencing pretty severe insomnia at night, then maybe pay attention to any other symptoms that may be occurring.
Yeah, that makes
The
sense.
next category is emotional or mood. So, are you experiencing more anxiety or irritability? Are you sad and you can't really shake that sadness and you don't really know why?
Mm.
Um, is there a lack of self-efficacy and you're really questioning, like, what's my worth? What am I able to do? What can I do? What am I capable of? Sometimes people become really uncooperative, and that's a change from how they were previously.
Mhm.
So, a lot of times with the emotional piece, that's where other people who know you well can come into play. So, with athletes, we really like to teach everyone who's involved in that athlete's life, from their parents to coaches to teammates to classmates at school if they're a young athlete, they can sometimes, often, be better equipped to say, this person's acting differently.
Mm.
Um, I remember there was this hit, and I'm thinking something is off, than the person who actually experienced it, because you're right, perception is completely different.
Mm.
So the third category is cognitive. And this can be really tricky for anyone outside to notice, but it can be glaring to the person experiencing it. This can include memory loss, really having trouble remembering short term, but also recalling past events. Confusion, there's often concussions afterward are often described as, I feel really foggy, like I'm in this brain fog. And along with that can be difficulty concentrating, very sensitive to light or sound, and having a hard time getting your words out,
Mm.
communicating. Um, that last one, actually, I wanted to mention because, slight anecdote, I I studied all of this for 5 years during my PhD, and I thought, "Okay, I've really got a handle of this. I understand concussions." And then I experienced one
Yeah.
after my whole program, and, it was a motor vehicle accident. Someone rear-ended me who was distracted. PSA, please don't text and drive.
Mm. Mm.
Um, and I felt okay initially. I didn't have any external injuries. My car was totaled, but I thought I was able to function probably by sheer adrenaline to
Mhm.
get through that experience. That evening, I was at home talking to my husband, and I just felt like it was taking me a long time to formulate sentences. And he was the one that said, "You might have had a concussion." And here I was, someone who had studied this for 5 years and spoken to countless people who had sustained one. And I couldn't recognize that myself. And so it took him to really see that. So that's just an example of the importance of
Yeah.
relying on the people around you.
And a perfect example of how whenever we get too big for our boots, the universe hands us some smackdown. As soon as I feel like I've got a handle on anything,
That's
the rug is pulled
exactly
out.
right. Exactly right. And I actually I look back on it and I think of it now as what I call an expansion experience. Like it
Mm,
really that was sort of the last piece for me to really understand on a much deeper level what it's like to experience this.
yeah.
And it was challenging and it shifted my perspective tremendously, and it gave me so much more compassion and appreciation for people that experience concussions. So
Mm.
for that, I actually am grateful.
Yeah, it's one of those things, isn't it? Whenever we're injured in any way, body or brain, you wouldn't want it, you wouldn't choose it, but the experience usually leads to such growth, and it makes you a better teacher and a better communicator about that injury, doesn't it?
Absolutely.
So it's lucky we don't get to choose.
Yes, indeed.
And you mentioned in that basket of potential emotional symptoms that lack of self efficacy. And I can imagine that really coming up for athletes who have, defined themselves by their performance and their ability to perform. But I imagine even for regular people, there might be this feeling of almost kind of isolation or loneliness simply because the symptoms can be sort of subtle, sometimes invisible from the outside. Sometimes they seem to come and go or change over time. And that really starts me thinking about where yoga can get involved to help people. So let's shift gears to that conversation. I know it needs medical treatment or some medical diagnosis, but when can we start getting yoga involved in that recovery picture?
So much earlier than you would think.
Oh,
There's
interesting.
a real misconception that after a diagnosed concussion or even a suspected concussion, the person needs to cocoon in a dark room with no external stimuli
Mm,
for a long period of time until they're fully healed. That was the old story, but we know now that that's actually detrimental and it prolongs the healing process. So, there is something called the Gradual Return to Play or Return to Activity guidelines that in the US, the CDC has. Neurologists will know about this, athletic trainers versing concussion will know about this. The idea is you gradually, step by step, go back into activity so that you're not exacerbating your symptoms by doing more than what your brain can handle at any given time.
mhm,
So, the first 24 to 48 hours after a concussion, you do need physical and cognitive rest. So, this is where we say really limit screen time, especially. You don't need to stay in a dark room, but if you're sensitive to light and to sound, then yeah, allow your body to relax. Guess what you can do during those 24 to 48 hours? You can practice yoga nidra. It
mm.
is so powerful for just restoring some normal brain function and really giving yourself that deep, deep rest that your body needs because you need to conserve energy so that all the energy, all that glucose can really go to the brain to heal it.
Mm.
So that is where you can listen to a guided yoga nidra meditation and practice that. Even if you've never done it before, this is the perfect opportunity to.
Mm.
And then I won't go through each stage in detail, but if you go through those 24 to 48 hours without having symptoms, or they resolve at the end of 48 hours, then you can move on to stage 1. That first stage was sort of stage 0. And stage 1 is daily activities that don't aggravate your symptoms. So what tasks you do need to do around the house? Nothing crazy, but just the typical. If that is pretty good for 24 hours, no exacerbated symptoms, then you move on to the next stage, and that's some light aerobic exercise. So, kind of going back, before you get to the aerobic exercise, you can do some gentle stretching. You can start to move your body a little bit, especially knowing that your body probably was affected below your neck as well.
Mm.
There may be some tightness. If you saw the hit coming, you might have gripped, and there's some muscular changes that happened as a result of that. So very, very gentle yoga, again, as long as it doesn't exacerbate symptoms.
Mm-hmm.
We'll talk about contraindications in a bit. There are some things to keep in mind, but you can absolutely start moving. You can also, as you're ready, go to a group class if it's a gentle one, because that can help you connect to people again. And I always tell athletes or anyone who's had a concussion that if you do go to a yoga class, please tell the yoga teacher at the beginning of class what you're experiencing, what you're recovering from, and say, I may need to rest in child's pose in the back of the room for 95% of the class. But the energy from that room can be really healing, and it can help you alleviate some of those feelings of loneliness and isolation.
Mm.
And as you move through, you can start practicing a more movement focused yoga class before you get back into your drills if you're an athlete, or harder aerobic workouts. I wouldn't necessarily recommend a power flow until you're really ready for that. And that may be a week, that may be a couple weeks after your injury.
Mm.
But again, paying attention to the gradual return to play guidelines, the 7 stages that you'll move through. And what's so powerful is that what yoga does is it addresses each of those 3 categories of symptoms in different ways. And when we talk about yoga, we're not just talking about the asana, right? So incorporate ujjayi breathing, incorporate alternate nostril breathing. You can do that early to help your cognitive symptoms.
Mm.
Focus on guided meditations or lead yourself through a meditation that is centered on self-love, acceptance.
Mm.
Um,
Impermanence.
Yes,
Mm.
impermanence. Just watch your breath and recognize that each cycle reminds you that this too shall pass. So there's so many tools that we have as yogis, as yoga teachers, to really help and facilitate the healing process.
Yeah. And your general advice is to stay at a level of activity for at least 24 hours and see how your symptoms respond. And then you can take a small step forward, another 24 hours, see how you respond. Great. That makes sense. And that sounds pretty easy to follow. And you mentioned breath work. I'm guessing there are probably some pranayama techniques that would feel more healing and more restful than others. Do you have suggestions around contraindications with breath work?
Again, every person is going to be different and respond
Mm.
differently. So I think the key is for anyone to just have acute awareness of how these different pranayama techniques are affecting them. But typically, if you're sticking to the more calming, parasympathetic inducing breathing practices, then you're going to be safe. So alternate nostril breathing and um, 4-7-8 breathing. I think as we start to get into breath of fire and some stronger pranayama techniques, then yes, you may aggravate some symptoms. So just paying attention, and if all of that is too much to manage, then just simply observe your breath. Watch it
Okay.
moving in and out. And that can be certainly be enough.
And I mean, I would give exactly the same advice really to anyone who's practicing because even though the ancient yogis did their own research of the suggested outcomes of different techniques, people do vary, especially given whatever state we come into that practice with. So I guess that would be my advice for anyone. This is intended to be a calming breathing technique. Notice if it's feeling calming for you. Notice if it's giving you that feeling of down regulation or whether it's creating any sense of anxiety and respond according to your experience. What about restorative yoga? Is that something that you would suggest early on in that sort of yoga nidra phase, that deep rest and relaxation?
Yes, early on and then continue it throughout. We really, the body has been shocked into a sympathetic state
Hmm.
after an injury. And so, again, to conserve energy and really facilitate healing, you want to tap into the parasympathetic nervous system as much as possible. So, restorative yoga is wonderful for that. And it also really helps with the emotional stuff that you're
Mm,
likely going to deal with after a concussion as well. So that can start pretty early. Again, paying attention to the fact that your muscles may have most certainly did experience some level of trauma as well.
mhm,
So when we say use all the props and restorative, we really mean it here. Um, so really supporting yourself and making sure you're not gripping and and again just paying attention to, does this make my symptoms any worse? Is my headache worse? Do certain poses put extra pressure on my neck, for example?
mm,
Avoid those and adjust, and then keep moving forward. And know that some days, this is again what we tell everyone, right?
mhm.
Every day you show up on your mat, you're going to be different. You're a different person. There's a different constitution. So honor where you are on that day and be patient and very graceful with yourself.
I think that's great advice. And again, for everyone, that's very reassuring for teachers of group classes who have somebody come post concussion. This is the same advice we would give to everybody. And I'm thinking when I get in my mind headaches or dizziness, I start to think about things in sun salutations like folding forward, standing up, or balance poses. So I'm starting to think about contraindications. Do you have some sort of general guidelines that we might think about?
Yes, I do. Well, again,
It's
if
going to depend on the person, I'm guessing.
it is going to depend on the person, but there are some things that I absolutely recommend avoiding, especially in the early, I would say at least the first week, if not more. If you move through each of those stages of the graduated return to play or return to activity relatively quickly, meaning you're in each one for about 24 hours, then you're still not all the way through it for a week. So, keeping that in mind, there are some things to pay attention to. One is what you said about dropping your head below your heart, any sort of inversion. This can be the simplest forward folds to obviously the more advanced headstand, handstand. Avoid those entirely. You don't want to put any extra pressure on your brain in this very sensitive time. Um, you also don't want to risk further injury, whether
Mm,
that's to your neck or to your head. So avoiding those. Um, paying attention to your neck. I like to advise people to not keep their head in alignment with their shoulders much more than they typically might in a regular yoga class when they're completely healthy.
mhm.
So in Trikonasana, for example, instead of looking up at that top hand, just look straight ahead, again, in line with the direction of your shoulders. You can even do that depending on how you feel in something simpler like Warrior Two. instead of looking over that shoulder, just look straight ahead. Just trying to keep your neck in neutral as much as possible can certainly help.
Would you
Those
do that
are
when the head's supported as well? Like, say you're lying down for a supine twist, would you still keep your head centered with your chest when its weight is supported by the floor? Yeah. Okay, great.
I would at the beginning until you know for sure that,
Mhm.
okay, I'm not having any worsened symptoms here. Let's try. Let's see if I can turn my head a little bit. Also, your balance may very well be
Mm.
compromised. So if you don't typically use your hand at the wall for some balance postures, maybe this is the time to have that available to you.
Or keep a
Don't get
tiptoe on the
proud.
floor.
Yes, absolutely. Absolutely. Like we always this practice is about getting beneath under to the stuff beneath the ego, right? Like
Yeah.
not paying attention to it. So it's so important as you're healing to let that go and go over to the wall, hold on to a chair, a sturdy chair, keep your foot on the floor, whatever that means.
Mhm.
Just know that the last thing, and this isn't necessarily a physical thing, but it's more cognitive. It can be very difficult to focus and to understand sequential tasks. So if you're taking a group class and the teacher is speaking through some cues, um, you may not be able to follow entirely, and that's okay. And that can be very surprising and shocking. I experienced after my concussion having to really think through what I did as soon as I woke up in the morning, right after I got out of bed. We don't think about going in the bathroom and brushing our teeth and all of that typically. But I
Mhm.
had to think, okay, I'm going to take one foot in front of the other until I get to the sink. And then I'm going to grab my toothbrush. And I really had to break it down. And so you can imagine when you're in a yoga class
Step your
and
right
the
foot
cue,
forward, turn your toes out, bend your knees, sway your
right,
hips, lift your chest. 100.
right.
The whole laundry list of cues would be bamboozling. Oh my goodness, yeah.
Exactly. And that's important for teachers who are teaching anyone who has had a concussion to understand as well, is to keep it very general, focus on the outer form of the pose, but minimal cues because they
Mm,
really, too many of them can serve as a distraction and it can overload the brain much quicker than
mm.
if you're dealing with a non-concussed brain.
So I'm starting to think if I'm working with somebody one on one who's recovering from a concussion, I'm thinking it's going to be a very interactive session. I'll be asking them questions the whole time. How's that feeling? What are you noticing? Could you soften this? Could you relax that? How's your breathing? And I'm guessing if I were doing sequences, I'd keep them short and simple and my cueing to a minimum.
Yes, absolutely.
Mm,
The most important thing you can do, all of us can do as a yoga teacher, is to hold space for them to move through whatever they need to move through. And
mm,
so in those early days and weeks, it's less about the perfect alignment. While that's important because we don't want injuries ever, we really want them to know that they can reestablish that connection between their mind and their body, between their breath and their spirit. They can, and you're there to facilitate that. So, yes, keeping the alignment cues to a minimum and really maybe even drumming up the positive reinforcement, the affirmations, the I'm here for you, like we're in this together.
mm.
That's really important here.
You mentioned in the course too that you might start a one on one yoga session with the question, what symptoms are bothering you the most today? And that to me was a great way to get people having a higher sense of control over their outcomes. And they're not just subject to the symptoms coming and going. They can name them, they can call on tools and techniques that might make them feel a little better. And it also implies today might be different to tomorrow, might be different to yesterday. So it reinforces that idea of things are going to come and go. Don't make it more than it is. Let's just deal with what we're dealing with today. So I thought that was a great suggestion.
Yes, that's exactly right. And it
Mm,
also allows you to spend some time thinking about the things that they don't mention, the symptoms they don't mention, and then incorporating some of those asanas into the practice to again help them remember that there are things you can do and there
Mhm.
are ways in which you can tap into your strength. You may have difficulty balancing, but how are you feeling flexibility wise or um, in other ways? So it's listening to what they're not saying as well, and then helping them to feel that strength and that connection in the ways that they can.
Yeah, I love that. Looking for opportunities where they can feel successful almost like, oh, yeah, I can still do this. That's great.
Yes,
Yeah, I
yes.
love that. So far you've been describing a progression that's pretty quick, and I'm guessing this is the optimal scenario of it's a week and you're back to normal. And but that's definitely not the case for everybody who has a concussion. And I know some people who've had symptoms, some level of symptoms continue for months. Is there any, do we know why that happens sometimes and not other times, or with some injuries and not other injuries?
It does depend on the type of injury to a certain extent, the
Hmm.
cause of the injury. So, sport injuries more often than other injuries resolve within 7 to 10 days. Again, that's maybe 80% of the injuries, not everyone. And that's assuming that you're not getting a second concussion in there somewhere.
Yeah.
um, Motor vehicle accidents can take a lot longer. And because I had studied sport concussions when I had my motor vehicle accident, I was expecting 7 to 10 days. Well, that was not the case. And I was questioning, and there is this fear that comes in. And again, I thought I knew this stuff, but there's fear that am I ever going to be whole again?
Mm.
Um, so yes, it is so, so, so common that symptoms persist, especially things like post-concussion headache. That
Mm.
can be very, very common and last 3 months, 6 months longer. And also, recovery isn't linear. So it's important for people to pay attention to, oh, okay, I'm doing okay. I've been doing okay for the last couple of weeks. It's been a few weeks since my injury, but now something's starting to shift. Maybe there was a trigger. Maybe they're now in an environment with a lot of people and they hadn't been in
Mm.
that type of social setting in a long time. And the brain's triggered. And so symptoms come back. Paying attention to that and not being fearful and just saying, okay, we're just going to move through this. Let's go back to basics,
Mm.
um, is really important. We don't know why every single concussion is different. We don't know why the recovery is different, but every brain is different and everyone's history with concussions is different.
Mhm.
Um, Everyone has different sensitivities just in general, and particularly after an injury. So it's just important to pay attention to your story, your journey, not compare it to anyone else's, not even really attach yourselves too much to the statistics, um, because the more patient you can be, the easier the whole transition will be and the recovery ultimately will be.
Yeah, I think that's fantastic advice. It's nice to know some stats in the back of your mind to give you some shape around your expectations, but individual experiences vary so hugely that there's no point getting attached to those, and it can just lead you to getting beyond your experience and telling yourself a story about what you're experiencing that makes it, 10 times worse, or brings up a lot of fear, or brings up a lot of stress, when really all you can control is your response. And if you can notice, relax, it creates space for those things to come and go like they so often do.
Oh, that is so key. I can't tell you how many times I've reminded people of that, of pay attention to the facts and not
Hmm.
the stories about the facts,
Hmm.
because you're absolutely right. That's the mindfulness practice, right?
Yes.
Being accepting of things as they are, knowing that the more you do that, the easier it is for them to move on through,
Mm.
and you just keep coming back to center and to present.
And there's a reason why there's a whole industry growing up around mindfulness is because it is easy to say, but it's really hard to do, especially when you're in the
Absolutely.
midst of it and you're like, yes, but it's me.
Yes.
So that's great. I think that gives us some really clear advice and I think is quite a reassuring conversation around concussion, which can be scary, I think. Anytime you think about an injury to the brain, to me that kind of brings up higher stakes because there's a potential for ourself to be altered by that. And so I think this has been a really reassuring conversation. So to wrap up, are there any sort of common misunderstandings or things that you hear said a lot that you'd like to take the opportunity to bust?
Mm. Well, we already talked about how this is a very heterogeneous injury and it
Mm,
manifests differently in everyone. We talked about how healing isn't necessarily linear.
mhm.
So to practice that patience and grace.
You talked
One
about not
thing,
necessarily cocooning for a week, shutting out all
yes,
stimulus. Yeah, that's helpful.
exactly. That is very helpful. Um, Also, this is circling back to your husband's story and to the story that a lot of people have. And that is that first, a single concussion does not mean that your brain is absolutely doomed,
Mhm,
that you'll develop neurodegeneration with older age. The key is to prevent repeat concussions, but even within that, it's allowing the brain time to heal in between concussions. So, the vast majority of people who have a history of repeat concussions are not going to develop neurodegenerative diseases that are related to those concussions. We don't know if repeat concussions cause neurodegeneration,
mhm.
things like Alzheimer's, Parkinson's, chronic traumatic encephalopathy, that's CTE, that people may be familiar with now. We don't know if there's a direct cause. We do think that if someone sustains repeat concussions in a short period of time, so the brain didn't have a chance to heal in
Mhm.
between concussions, then they are more likely at risk of potentially developing some neurodegeneration outside of the norm. So the key is potentially at increased risk.
Mhm.
That's potentially a correlation, and that's very different from causation. So, right now, fear does no good for
Mhm.
anybody who either has a history of repeat concussions or is in a sport like football, like hockey, like soccer, or football for the rest of the world. Um, the fear doesn't help.
Mm.
What you can do is, especially for those that are still playing their sport or are just engaging in the world, is really paying attention to that key fact that if you have a concussion, even if it's your 10th concussion or if it's your first concussion, sit it out for a while until your brain has fully healed.
Mhm.
And that means all symptoms are gone. Um, when I say sit it out, I'm not saying cocoon,
Sit out
but
life, sit out your
yeah,
sport, sit out the risk of
there
another
is.
concussion.
Yes, that's
Mhm.
exactly right. And if you're having some symptoms like headache a year later, then maybe you do want to reevaluate your relationship with your sport. Um, or you just put in some other extra practices in place. So,
That's where my mind was going because I was thinking, I used to trail run and I'm pretty bendy. So I would sprain my ankle and then before it had fully healed, I'd sprain it again. And before it had fully healed, I'd sprain it again. Is that ankle doomed for the rest of my life? No, but I definitely do some strengthening and stabilizing exercises for that ankle, knowing that there were probably some connective tissue changes that I can now repattern. And I'm sure there are things we can do with our brain too to keep the network strong and communicating well.
Yes, exactly. And those are sort of basic brain health hygiene things that all of us should be doing. That's
Hmm.
getting outside, that's engaging and interacting with nature, that is maintaining our social connections. We're social creatures, and the past 2.5 years have been a little bit different with that. But we need that support and that shared love. It's eating healthy, paying attention to your nutrition. I mean, what we eat has such a huge effect on how the brain functions. It's keep going or start your meditation practice. It's moving your body in ways that are safe. All of these things are
Sleep.
so critical to sleep,
Yeah.
critical
Yeah.
for brain health. And that goes whether you're recovering from a concussion, wanting to prevent neurodegeneration, or just wanting to live a healthy lifestyle.
That's great. And I think that's a really powerful place to wrap it up. Just reminding people that there are always, always, always positive things that we can do to take charge of our health, physical or mental. So you are not just the concussion person. You share a lot of really helpful information on mental performance and sports. So if people are interested in you and what you do, where would you send them to find out more?
Yes, well, there's my website, which is diagrant.com, and you can connect to me directly through there. There's also Instagram. That's the one social channel that I am active on. And I love that's actually how we connected
Hmm.
initially years ago was through Instagram. And my handle is just Dr. Diagrant. Um, and yes, I love authentic connections. So absolutely reach out. And I look forward to connecting with whoever may be listening.
Brilliant. Thank you so much for your time. I've learned a bunch, and I'm sure the listeners have as well. Thank you.
Thank you.
Thanks for listening to Yoga Medicine. If you liked the show, be sure to subscribe and leave a rating and review on Apple Podcasts or wherever you listen to podcasts. And if you got something out of this episode, please spread the word and share it with a friend. You can find more information, articles, trainings, and classes at yogamedicine.com. Check us out on social media as Yoga Medicine, or you can email us at info@yogamedicine.com. Thank you for being part of our Yoga Medicine community.
The content of this podcast is not medical advice and is not meant to replace medical care. Please consult your healthcare provider to determine what is best for your unique healthcare needs.